Welcome to our in-depth exploration of shock, a critical medical condition that can quickly turn deadly if not addressed promptly. You see, our bodies are finely tuned machines, and when something disrupts the flow of oxygen-rich blood to our vital organs, things can go south pretty quickly. Today, we'll be diving into what shock is, its various types, and how it can be treated. We'll explore the intricate workings of the human body and understand how different factors can lead to this life-threatening condition. Think of this video as your comprehensive guide to understanding shock, empowering you with the knowledge to recognize its signs and act swiftly when necessary. Because let's face it, in the vast expanse of the cosmos, our time on this pale blue dot is precious, and understanding these critical medical conditions can make all the difference. So what exactly is shock? Imagine a bustling city, its streets teeming with lifeblood, transporting essential goods to every corner. Now picture a sudden gridlock, a standstill that cripples the entire system. That's what shock does to your body. In medical terms, shock is a life-threatening condition that occurs when your body isn't getting enough blood flow to meet its needs. This lack of blood flow means your organs and tissues aren't receiving the oxygen and nutrients they need to function properly. Think of your circulatory system as a complex network of highways, with your heart acting as the powerful engine pumping blood, the lifeblood, throughout your body. This blood carries oxygen and vital nutrients to every single cell, ensuring their survival. Now, shock is like a massive traffic jam in this intricate highway system. It can be caused by a number of factors, from severe blood loss to heart problems, each disrupting the flow of traffic, the flow of blood, in its own unique way. This inadequate blood flow starves your cells of oxygen, leading to a cascade of events that can quickly escalate and become life-threatening. Your body tries to compensate, like rerouting traffic to less congested roads. But if the underlying cause isn't addressed quickly, the situation can spiral out of control. Understanding the nature of this physiological traffic jam is crucial because it allows us to recognize the signs early on and seek immediate medical attention, increasing the chances of a smoother, faster recovery. Let's dive into a specific type of shock, known as hypovolemic shock, a condition that arises when your body loses a significant amount of blood or fluids. Imagine a car sputtering to a halt, its fuel tank running on empty. That's hypovolemic shock in essence. This type of shock is often triggered by events like severe bleeding from injuries, excessive fluid loss from vomiting or diarrhea, or even severe burns. These situations lead to a drastic reduction in the volume of blood circulating in your body, much like a leaking pipe draining a water tank. As the blood volume plummets, your heart struggles to pump enough blood to meet your body's demands. Imagine a water pump desperately trying to maintain pressure with a dwindling water supply. That's the challenge your heart faces during hypovolemic shock. This shortage of blood flow deprives your organs of the oxygen they desperately need. Your body tries to compensate by constricting blood vessels in your extremities, diverting the limited blood flow to vital organs like your brain and heart. This compensatory mechanism explains why people experiencing hypovolemic shock often have cold, clammy skin and a weak, rapid pulse. Their body is prioritizing blood flow to the core, keeping the essential organs functioning as long as possible. Prompt treatment is crucial in hypovolemic shock. It often involves stopping the source of blood or fluid loss, replenishing the lost fluids with intravenous fluids, and sometimes even blood transfusions. Think of it as plugging the leaks in the water tank, refilling it to the brim, and in severe cases even replacing some of the lost water with fresh supply. The goal is to restore the blood volume and pressure, allowing your heart to effectively pump blood throughout your body once again. Chapter 3. Cardiogenic shock, when the engine falters. Now let's shift our focus to another type of shock known as cardiogenic shock, a condition that arises when your heart, the powerful engine of your circulatory system, isn't pumping effectively. Imagine a car with a failing engine struggling to power the vehicle. That's cardiogenic shock in essence. This type of shock is often a consequence of a heart attack which damages the heart muscle, compromising its ability to pump blood effectively. It's like a crucial part of the engine breaking down, hindering its performance. When your heart can't pump efficiently, blood backs up in your circulatory system, leading to a buildup of pressure in your lungs and other organs. Imagine a traffic jam caused by a stalled car blocking a major intersection. That's the congestion that occurs in your circulatory system during cardiogenic shock. This congestion makes it even harder for your heart to pump blood, creating a vicious cycle that can quickly deteriorate. It's like trying to drive a car with a flat tire. The harder you push, the worse the situation becomes. Symptoms of cardiogenic shock often include difficulty breathing, chest pain, and a rapid, irregular heartbeat. These are all signs that your heart is struggling to keep up with its workload, sending out distress signals. Treating cardiogenic shock involves supporting your heart function while addressing the underlying heart problem. This might include medications to help your heart pump better, procedures to open blocked arteries, and in some cases, even surgery. It's like giving your car a jump start, repairing the damaged engine parts, and ensuring the fuel lines are clear. The goal is to restore your heart's ability to pump blood effectively, ensuring a smooth flow of traffic throughout your circulatory system. Chapter 4. Distributive shock when the pipes malfunction. Let's delve into distributive shock, where the circulatory system's pipes malfunction. Imagine a city's water supply disrupted by leaky pipes, leading to low pressure. In distributive shock, blood vessels dilate excessively, causing a drop in blood pressure. Septic shock is one type, triggered by a severe infection causing inflammation. This inflammation leads to vessel dilation and a drop in blood pressure. Anaphylactic shock, a severe allergic reaction, causes similar vessel dilation. It's like an alarm system triggering a sudden drop in blood pressure. Neurogenic shock occurs when the nervous system is damaged, disrupting vessel tone. This leads to widespread dilation and a drop in blood pressure. Symptoms include rapid heartbeat, low blood pressure, and confusion. These signs indicate the body is struggling to maintain blood flow. Treating distributive shock involves addressing the underlying cause. It's like repairing leaky pipes or fixing faulty wiring. The goal is to restore normal vessel function and blood pressure, ensuring the circulatory system functions properly, like water reaching every destination. Chapter 5. Obstructive shock. When a roadblock appears. Finally, let's explore obstructive shock, a type of shock that occurs when there's a physical obstruction to blood flow in your circulatory system. Imagine a major highway blocked by a massive landslide, bringing traffic to a standstill. That's obstructive shock in essence. This type of shock can be caused by a pulmonary embolism, a blood clot that travels to the lungs and blocks blood flow. It's like a rogue boulder lodging itself in a crucial pipeline, obstructing the flow. Another cause is cardiac tamponade, a condition where fluid builds up in the sac surrounding your heart, squeezing the heart and impeding its ability to pump blood. It's like encasing the engine in a constricting shell, limiting its ability to function. Tension pneumothorax, another cause of obstructive shock, occurs when air leaks into the space between your lungs and chest wall, collapsing a lung and compressing the heart. It's like inflating a balloon inside your chest, squeezing your heart and restricting its movement. Symptoms of obstructive shock often include difficulty breathing, chest pain, and a rapid weak pulse. These are all signs that your heart is struggling to pump blood against a physical obstruction, like a car trying to power through a roadblock. Treating obstructive shock involves removing the obstruction as quickly as possible. This might involve dissolving a blood clot, draining fluid from around the heart, or inserting a needle to release trapped air in the chest. It's like clearing the landslide, removing the constricting shell, or deflating the balloon. The goal is to remove the physical barrier impeding blood flow, allowing your heart to pump freely and efficiently once again. It's about restoring the free flow of traffic, ensuring that the lifeblood reaches every destination unimpeded. Understanding shock, knowledge is power. Thank you for watching our detailed video on shock. We've journeyed through the intricate workings of your circulatory system, exploring the different ways this life-sustaining network can be compromised. We hope you found this information helpful and informative, empowering you to recognize the signs of shock and act swiftly when necessary. Remember, knowledge is power, especially when it comes to our health. Don't forget to like, share, and subscribe for more educational content. And as always, keep those brains engaged, those hearts pumping, and those bodies thriving. Until next time, stay curious.